Guidelines are being put in place to prevent abuse of the disabled at state-run or state-supervised homes. The governor's office announced that there is a new agreement between the Office for People with Developmental Disabilities and the state police. That came earlier this week. The goal here is to make sure that instances of abuse are reported and investigated. The guidelines are part of an ongoing effort to overhaul a very troubled agency that has seen some significant and quite disturbing instances of abuse in recent years. It is an undertaking that is being very closely monitored by my next guest. State Senator Roy McDonald chairs the Senate Committee on Mental Health and Developmental Disabilities. It is a pleasure to have you in the studio.
Thank you. It's an honor to be here.
So this is a really kind of not tried before situation, right, where you have a partnership between two agencies in the state. Will it work?
Well, I hope it does. We had a very serious problem. We saw the results of a study and research done by the New York Times of abuses across the state over the years. It was sad, it was frightening, and we had to do something. I commend the governor and his people for coming forward and accepting that. There's a lot of work that has to be done. The economics of our situation has put us in a terrible spot in so many different areas, and mental health and disabilities is another area. We have to recognize that the safety of these people it's critical, because these people are handicapped, either mentally or physically, or both handicapped with disabilities. They can't protect themselves, they can't help themselves, and it's every family member's worst nightmare to leave somebody in such a vulnerable position. At the same time, we have to recognize that we have 13 regional facilities across the state, and this population is almost 200,000 people, over 160,000 people in the state who are exposed to this problem, and we have some wonderful people who have worked in these facilities for decades. At the same time, we've had some people who have broken the law, have broken not only the law, but have been obscene in some of the things that they've done.
See, this is an instance where I think that there's some black and white areas, right? It's quite clear that if someone is sexually abusing a person who is at risk, vulnerable, and can't defend themselves, it's a crime that needs to be reported. What we're talking about here is that a mandate that people who are working in these facilities must report instances of alleged abuse. They will be fired if they do not, and they are subject to charges themselves. The problem comes when, first of all, how do you enforce that sort of a thing?
Well, I think that the mission is the state police are involved. It's a better than average, authority, police authority. They'll be working with the local police and sheriff's departments and district attorneys. I think, number one, it tells anybody out there thinking of doing something wrong that they're going to pay a terrible price.
So it's like a prophylactic effort, right? That it's preventative in nature.
It's preventative, and it's also sensitive to the family members and the friends of these patients that are there, and I think it protects the legitimate workers very much so. Now they have an opportunity to do the job that so many of them do so well. And you know, when you're a family member, and I am a family member with 2 children with disabilities, 2 grandchildren, your nightmare is the bad workers, but the angels are the good workers. You have, I have 2 grandsons with autism, very young, that may be institutionalized someday, and you think that you're putting your whole life in somebody else's hand. And you have so much respect and affection for those workers that are doing so hard. At the same time, the ones that break the rules have got to know that you can't do this.
That there will be a zero tolerance
policy.
policy. The problem is, in some ways, you're asking people to prove a negative. You're asking people to say, you are going to be charged for failing to report something that you may or may not have known about.
We see that even in the workplace today. If somebody's being harassed for whatever reason, I don't think people should sit on the sideline if you're just in a standard workplace, normal environment, and there's prejudice occurring, somebody's picking on somebody because they're a woman, different color, or older person. You can't allow this stuff to happen. I think we all, as good citizens, have got to report that. That's really being a good person and a good citizen. And we don't want to harass people with these reports, so we want to put it in the hands of the appropriate authorities to judge them. I don't think that's what the mission is. The mission is to recognize, and as you and I have talked about, some of these issues, it's very difficult when you have people who've got these mental and physical disabilities, restraining them so they not only don't hurt somebody else, they don't hurt themselves.
Well, right. So this is the area, this is what I would say is a gray area, in so much as you have a population of people who are sometimes can be violent towards themselves and
Right.
others and do need to be restrained, and there's a protocol for that.
Exactly.
But if a person is making a distinction between restraint and abuse might be difficult for someone to make.
Well, I think we'd have to turn to the professionals in the field. I have, as I mentioned, my own grandchildren, and sometimes they have to be restrained or they're going to hurt themselves or somebody around them. These are terrible human decisions that have to be made, but they have to be made. There should be some guidelines to protect the innocent people who may be charged with something, or the innocent, people with the disabilities that are totally vulnerable, especially at certain times of the day, when there's not a lot of people around.
Right.
I think we're going down a road that's very difficult, and we have to recognize that, show the respect we can. But, this is no different than if there was a hospital situation or the proverbial person in the dental chair that gets knocked out for a tooth decay, and somebody abuses them. I wish we didn't have to deal with those type of people in society, but nevertheless we do. We have to have some starting point, and we also have to have a protocol like the governor proposed with his people, and we have to have an enforcement agency like the state police. It cannot be tolerated, period.
Do you, obviously the governor is quite serious about this. There's been change at the top of,
Right.
Of the agency. That he's bringing in the state police. These are all obviously positive
Right.
things and significant things. The other issue, though, so the flip side of the coin is money. And
Well,
the
the
state
money-
doesn't have any.
Well, I mean, one of the sad things about being the chairman of the mental health and disabilities community is that we're in this economic situation, and you end up playing King Solomon. Who gets the support and who doesn't? And I think the public has a sensitivity to that as well. Obviously, in our society, we're going to have to start making priorities, and priorities are human beings. Whether it be the people with mental health or disabilities issues or physical issues, nursing homes, hospitals, education. This is not an easy time to be making those decisions. So you want somebody who is willing to be reasonable, understanding, and recognize what we're up against. Now, every time I deal with the public, I will always ask them, and I've done seminars and public hearings across the state, and we'll be doing more. The realization that we have a moral obligation as a society to take care of these folks.
Yeah.
And that we're not perfect, we're going to be making mistakes, but we will accept that responsibility.
To that end, and unfortunately we're out of time, but I just wanted to ask quickly, to that end, will you be asking the governor and your colleagues to increase the budget for these agencies?
Yeah,
in the next
I
go-round?
think it's a reality that we have to address some of the, the things that are growing in our state in the mental health area, and we're going to have to address that issue. Now, what I'm going to do is start doing that this year as opposed to waiting into the, the March time frame when we usually
Right.
do this. Now, this past budget, both sides of the aisle and both houses, along with the governor who is leading, we recognize the economic problems, but we have done a little bit better. But we've also experienced maybe in some of the areas we couldn't cut. Maybe in some areas we could cut more. Mental health is a problem that's going to impact everybody's family sooner or later, and it could be a disaster in some cases if we don't deal with it. So we're going to have to make that acceptance. Now, ironically, I've only been the chairman for 6 months approximately of the mental health committee.
Right.
Both sides of the aisle, in both houses, people came up to me in that capacity and said, we support these programs, and we'd be looking at you and Felix Ortiz, my counterpart in the New York State Assembly, to help us get through this so we don't hurt anybody. We're here. These are the people that a society are supposed to help.
Okay, Senator, unfortunately we are out of time. It is unfortunately also an ongoing story. We will have you back,
Thank
of
you.
course. Senator Roy McDonald, it is great to see you. Thank you.
Nice to see you. Thank you.